As I've mentioned, Dr. Derek Yach, he's the president of the Foundation for a Smoke-Free World, which is a global health expert and anti-smoking advocate for more than 30 years. He's also a passionate advocate for health promotion and disease prevention. He joins us now this morning to share more on the challenges for organizations to encourage people to quit smoking. Dr. Yach, a very good morning to you. Thanks for joining us. Welcome to Morning Live.
Hello, good to be with you.
So has there been any research done or scientific proof, perhaps, on the dangers of smoking during this COVID-19 pandemic?
Well, it's very interesting. At the beginning of the pandemic, we were convinced that the smokers would have about the highest risks possible. But in fact, we haven't seen that play out. And there's a suggestion that there are less smokers appearing in the hospitals than there are smokers in the population. Now, we wouldn't want people to think that suggests that smoking is good for you or good for reducing COVID-19. It isn't. But it may very well be that nicotine is playing a role in potentially preventing the severity of COVID-19. And that's why in France and in the UK, they're using the nicotine patch to test whether it will prevent the severity. But for smokers, the message remains very clear. It's best to quit. It'll reduce your risk of lung cancer, heart disease, chronic lung disease, and even tuberculosis.
Well, so far we know that smoking affects the lungs, and some health experts during this pandemic have said that since the coronavirus is a respiratory disease, so smoking is definitely a breeding ground for lung diseases. So what is the correlation between the two? And what's your understanding of COVID-19 and smoking?
Well, I think my understanding is based on maybe 15 to 20 studies that have only been done in the last 3 months, of course, because of the pandemic. If you look at China, Italy, US, UK, you find generally fewer smokers going into hospital with COVID-19. And that is very surprising. More than that, in the UK, they've looked at 17 million patients across England, and they found that the smokers had the lower rate of COVID-19 compared to those people who smoked way back. So the message isn't as simple as saying, if you smoke, you're going to increase your risk of COVID-19. The message is, if you smoke, you're going to die of lung cancer, heart disease, tuberculosis. But for COVID-19, we're going to probably have to wait to be certain. And one of the things we will do on Monday, in fact tomorrow, is launch a call for research to try and understand this urgently, which we will also support over the next few months.
Okay. So what does the current WHO report say on the trends in the prevalence of tobacco use now? Is there any progress made in reducing the demand for tobacco?
Yes, the good news is that since the first World No Tobacco Day, which was in 1988, we first saw an increase in deaths from tobacco. And you might remember that the first World No Tobacco Day was celebrated in South Africa, and I was still at the Medical Research Council. We brought out a report that showed that there were 3 million people dying a year. The figure has now gone up to 8 million a year, and we expect it to continue to rise. But while the death rate is going up, the amount of smokers in the world for the first time have started to come down. And that is the good news. We still have over 1 billion people who smoke and use tobacco products. But the reason that the death rate will rise for many months and years is because it takes years before you get the death and disease from smoking, even if you stop.
Now, Dr. Yach, since the Framework Convention on Tobacco Control development, a range of new reduced risk alternatives to smoking were also introduced to consumers that separate the nicotine from the tar. Can you share more on this?
Yes. When the Framework Convention was first developed, we included in the text the importance of addressing what's called harm reduction. At the time, and that was 20 years ago, all we had was nicotine replacement therapy, as well as snus, which is a moist snuff. Mm-hmm. Since then, and over the last decade, we've seen e-cigarettes come along, vapes come along, heated tobacco products. All of them do the same thing. They separate the effect of nicotine, which does not kill you, and it's very important smokers understand that, from the toxic stuff in the smoke, the combustion, that does kill you. And we now believe that the use of these reduced-risk products could accelerate the decline in deaths quite dramatically over the next few years. And we're seeing that happening in Japan, Korea, the UK, Sweden, Norway. In fact, in all countries where you're seeing high levels of some of these smokeless products, particularly the reduced-risk ones I'm talking about, we will expect an accelerated decline in death.
All right, Dr. Yach, we appreciate your time. Thank you so much for joining us this morning.
Thank you. And have you all quit tomorrow for World No Tobacco Day, today in South Africa?
All right, great stuff. We just spoke to Dr. Derek Yach, the president of the Foundation for a Smoke-Free World, on World No Tobacco Day. Now, this yearly celebration informs the public on the dangers of using tobacco and the business practices of tobacco companies.